nervous. Hi, everyone, and welcome to the next episode of Welln'ish. Today, as usual, we're here with a little bit of some TMI. Our episode today is going to be all about poop. I've invited a very awesome pelvic floor specialist to come and talk to us about the link between going number 2 and your pelvic floor. So without further ado, I'll let our guest introduce herself.
Aïcha Myriam Diarra. I'm a physiotherapist currently working at the Centre de Santé Pelvienne in Kinatex Pointe-Claire. Basically, I graduated about a little bit more than 4 years ago now in 2018 from a master in physiotherapy at Sherbrooke University. And after that, I decided to get a little bit more specific about pelvic health. So that's when I started approximately 4 years ago too. And ever since, I started a little Instagram account.
It's amazing. You need to follow it.
Thank you. It's part of my hobbies, what I do also on the side. Let's say other than working, because we know when we leave work, we're not really leaving work. We bring a little bit of the patients with us at home. And besides that, during my spare time, I just like to read, dance, and that's pretty much it. Yeah.
Awesome. Well, I'm happy to get to know you better. For anyone listening who comes to my clinic, I have for sure referred you to the clinic that she's talking about. And if you watched any of the previous episodes, we actually interviewed the clinic owner, Marie-Josée. So they're a really strong team. I strongly encourage all of you to go see it if you're in the West Island. They're really such a great resource that we have here.
Thank you.
So I'd like to kick things off and get straight to it. So my first question would be, can you please explain why bowel movement health is such an important part of pelvic floor therapy and what the anatomical links are to the pelvic floor?
Yes, for sure. So the bowel movement is deeply connected to the pelvic floor and vice versa. Actually, there was a course from Eurosanté. Eurosanté is a really, let's say, this huge platform where they give courses in person, but also through Zoom. So there was a course strictly on anorectal pelvic health. And for example, if someone tends to be constipated, the chronic straining is going to lead to the pelvic floor muscle weakening. And this can lead to stress on the nerves going through the pelvic floor, the ligaments, and eventually even creates prolapses or hernia, or even anal incontinence. I feel like the bowel is also very close to the bladder. And sometimes I've had patients coming in with urge, like bladder incontinence or urge incontinence. And they don't even know that all of this is actually connected to the constipation that they have. So I do feel like it's really important. And we know the bowel will end with the rectum and the anal canal. So sometimes I feel like we're asking questions during the questionnaire and people say, oh, no, I'm not really constipated. But as we get through the assessment and we ask more about the anorectal area, it's also a way for us to assess if there's any like fecal incontinence or anything related to the anal canal, because the pelvic floor actually goes from the pubic bone all the way to the tailbone. So, yeah.
Exactly. So what are some examples of questions that you would ask in that first meeting?
Oh, good question. So we do ask a bunch of questions, but if you want to know what we ask more related to the pelvic floor function with the constipation, we would ask, for example, how often they go to the toilet just for the bowel movement. Let's say if they have to strain a lot, if they're constipated, because some people don't make the difference between constipation, straining.
I've noticed that a lot of people think that constipation means straining.
Yes, it's true. So we do ask questions like this. We ask about the stool consistency, if there's any blood in the stools, if they feel bloated too, and I'm pretty sure you hear that often.
So often.
People are going to say, no, I'm not constipated, but then they have cramps, they feel bloated, and they feel like they're not emptying their rectum properly. So
absolutely.
But So that's some examples that we would ask.
Awesome. And what should normal pooping habits look like? I hear people all the time say, "Oh no, I'm not constipated," or, I everything is fine. My doctor said everything is totally normal. And I want you to clarify, because I explain this to my patients as well, is that there's normal in the sense that you have no pathology. Like, I really try to reinforce that on the podcast, is that doctors really try to find the red flags. They try to eliminate anything very serious. And then, like, the alternative health or the rest of the spectrum falls under, more our category, which is how can we optimize it for like good pelvic floor health, for like your abdominal health, for good, like your optimal digestion, I guess. So all this to say is what is the gold standard for you guys in terms of frequency of bowel movements?
It's a good question. And I feel like there's not a real answer to it. Someone could go to the bathroom for their bowel movement, let's say 3 times a day. They could also go 3 times a week, and they wouldn't be necessarily constipated. But I would say if someone is either straining, feels bloated, feels like there's, the stools are harder, feels like they don't empty properly their bladder, those are really a good indication that they might be constipated, and it's really important to do something about it. I feel like sometimes it just becomes our norm, so we're gonna go through that. And I feel like where I find people would not be sure is, let's say you ask them, okay, are you constipated? And as you say, they tell you, no, my doctor told me I'm fine. But then I don't understand why I have hemorrhoids, for example. And that's a good indication too of constipation or even fissures. So things like that are not supposed to be present, let's say.
Perfect. And then you mentioned earlier stool consistency. So what should an optimal stool look like? And I don't know if you have the chart with you, but I would love to see it because I find it so useful.
I actually brought it with you. I don't know if you ask your patient also those same questions. I feel like it's always a bit funny to ask them about that. Yeah. And some people even say, "Oh, you have a whole chart about that." So I brought because we do treat like men and women, but we also treat kids. So I find the peds one really funny.
That's awesome.
Yeah. So for the people who are going to watch online on YouTube, this is the Bristol stool chart. Perfect. And it goes from type 1, which are really hard lumps, really hard, really dry. And it goes all the way to type 7, which is really liquidy stools, let's say. But usually we're looking anything that would be closer to the type 4, which is something really formed like a sausage almost. That's really what we're aiming for, let's say.
That's great.
Yeah. Now, oh no, sorry, were you gonna say something?
No, I wasn't.
Okay, well, I was just gonna say now, if someone comes in and they tell you, oh, I've had diarrhea sometime, or I've had like really hard stools, and it's just, let's say now and there, not something very common or consistent for them, then it's not really problematic. But definitely if it's something that happens often, it might be something to take a look at.
I find it's just so useful because this is not a subject that people like to talk about, especially women. Like I still have friends who like whose boyfriends don't like, they're like never ever talk about poop. They don't know their girlfriend farts. Like it's it's funny. So I just think it's important to show these actual visuals because we don't know what normal is until we see something like that. So anyways, I'm very grateful that you shared that with us.
Yeah, that's very true. And I feel I even had a patient, she had an underlying condition, but she always she has type 6 all the time, which like again, if you remember, it's really close to diarrhea. Yeah. And for her, it was her norm, right? Yeah. But again, as you say, like once you get a really a good idea of okay what it should look like,
Hmm.
then you can notice, okay, maybe I have an issue actually. So,
Exactly.
hmm
Exactly.
hmm
Makes so much sense. So, what are some rectal anal dysfunctions that the root cause can be a pelvic floor dysfunction?
Okay, so actually, well, for fissure and hemorrhoids, it's for sure going to be a vicious circle.
Okay.
When someone comes in with one of that, usually it can lead you to thinking, okay, maybe there was a problem with constipation prior to this.
Hmm.
But it might also be something that happens. And I know you treat a lot of new moms or pregnant women.
Yes.
So sometimes it's not necessarily that they're constipated, but let's say they just delivered and they pushed for a long time. There
Hmm.
might be a little bit more chances of having hemorrhoids. So in that case, then you're going to try to prevent yourself from pushing because it's painful, and then it
Yes.
creates the vicious circle. But something very interesting is there's actually two types of constipation. Well, in physio, we qualify them in two
Okay.
different types. I don't know if it's the same in osteo. And we would speak a little bit more about, let's say, the terminal constipation.
Okay.
Sometimes I find like when I say that to patients, they think, "Oh my God, terminal, is that something really bad?" But it's just it's just to say that it's really like at the end of the bowel, so the
Yeah.
rectum and the anal canal.
Okay.
Whereas let's say something related to the intestinal transit is something that we could help definitely, but most of the time then we're gonna ask the help of osteos, for example, or
Hmm.
even just go and see a healthcare practitioner to make sure that there's nothing else.
Okay.
But yeah, so for the terminal constipation, usually it will start with the anal problem. So either there's too much tension in the sphincters because the anus is actually let's say split in two huge sphincters. So there's the external sphincter that we can control, and then there's the internal sphincter that we don't really control.
Okay.
And at the top, we have a muscle, the pubirectalis, which
Hmm.
is the muscle that we talk a lot when we can maybe discuss that after, but when we ask people to use a little step stool to place their feet on.
Hmm.
So, so if that part is really toned, which is a lot of tension in the muscles,
Hmm.
or even if when you try to void your stools, it contracts, well, for sure you're going to have a hard time to void your stools. And
Makes sense.
then often with time, that can lead to rectal constipation.
Hmm.
And that's really the increase. Well, there could be two reasons, but most of the time it's the increase of the volume of the rectum. So it
Okay.
takes more stools to actually feel that you need to go and void your
Oh, I see.
stools. Yeah.
And
And
what kind of risk factors, like who's predisposed for that problem specifically?
oh, actually, you know what? Women tend to have a little bit more chances of having constipation. It was in a study. I don't know why, but even kids could have those type of constipation. And
Okay.
we do treat a lot of kids coming in for issues of constipation, and often people are going to think that oh they have diarrhea because it stays for so long that
Hmm.
it doesn't void, and eventually it's going to
Right.
become a little bit more liquid. But
Okay.
for example, people with prolapse
Yep.
or rectocele could actually have issues like that, or even with people with tense pelvic floor,
Hmm.
because as the constipation is happening often and often and often, then the let's say size or the volume of the rectum will increase.
Hmm. I see.
Yeah.
Can you
And
explain a little bit, just for some people who are not familiar, what a prolapse of the rectum is, and again, who could be predisposed to that, and what it could feel like, and what some warning signs would be?
oh yes, so the prolapse of the rectum is actually the rectum kind of loosening its walls, and because of that, it's going to have a harder time to push the stools out. Whereas the rectocele is actually the rectum starting to push towards the vaginal canal in people with vaginas.
Okay.
So that's a different, and the signs of it. It would be hard to tell if you don't know, because sometimes you just feel like you're constipated and you're not able to void, right?
Right.
But some people are going to feel like there's a lot of heaviness around the anal canal if they talk about the rectum prolapse.
Hmm.
Whereas with the rectocele, if it becomes a little bit more, if it becomes bigger, some people are going to feel like, oh, something is pushing through my vagina, for example.
Okay. Okay. Wow.
So that would be some things that would maybe guide you into thinking that, oh, there
Hmm.
might be a prolapse or a rectocele.
And are these more common in somebody, let's say, postpartum, who maybe has some weakness in their pelvic floor, or could it also be somebody with like a lot of tone or hypertonic?
Mhm. It's actually a good question. For sure, someone who's postpartum, as you say, the muscle is not back to its optimal function yet. So for sure, if you start pushing, or unfortunately, we've seen with COVID, a lot of people they coughed a lot, and
Hmm.
then they created a prolapse. So for sure,
Okay.
you might be more prone right after a pregnancy and a delivery, which might be why you want to avoid doing certain type of things until your pelvic floor is ready for it.
Hmm.
But even in people with a lot of tension, it could create prolapse, because if you're never voiding your stools correctly and you're always consistently pushing and pushing and pushing,
Right.
well, it's gonna eventually, it has to go somewhere, right?
Yeah.
And in the women, most of the time, because we have that hole, it's easier to have a prolapse through the
Right.
vagina.
Okay.
Whereas, yeah,
That
yeah.
makes sense. I want to come back to the peds. I know I didn't put this on our questions, but I I didn't know that you guys treated kids as well, and I've actually been treating quite a few kids who have some constipation. So I was just wondering what your approach is with them, how it works, like what a session would look like for children versus an adult.
Right. Yes. So, well, as you must know, in pelvic health physio, usually we do have to do the internal assessment, vaginal and anal.
Yes.
In men, just anal, not vaginal. Now, in kids, the approach is a little bit different, in the sense that for anyone, we would try to talk a lot about the behaviors that they have through the day. But in
Hmm.
kids, we're going to try to focus maybe a little bit more on the behaviors. So let's say
Okay.
we're going to ask if they drink enough water,
Hmm.
if they have a good schedule. Let's say, are they always changing the schedule so they're never going at the same time?
Right.
We're going to talk about trying not to postpone the urge. So if they feel it, they have to go. But
Hmm.
I feel like there's a lot of kids that, let's say, they're gonna try to go to the toilet, and as they push the stools, it might be painful,
Hmm.
and now they don't want to go anymore, right?
Yes, I see
So
that a lot.
I'm sure you do, yeah. And I feel like part of this is also because of the way they're sitting on the toilet, and they're not touching the
Right.
floor. So same as we would tell adults, it's also to ask them to, okay, well, you're just gonna place something under your feet, place your feet on top of it to make sure that you're touching, so that your muscles can relax. Because
Makes
the
sense.
problem is their muscle are not relaxing,
Hmm.
and because of that, well, they're gonna push and push more, right?
Yeah.
So I feel like often just with that, we can get rid of the constipation for a lot of kids.
Okay.
But then, unfortunately, sometimes if it doesn't work, we will have to do the biofeedback. So we try not to do any internal, but the
Hmm.
biofeedback is a good way to show them. The biofeedback is just like electrodes that you place on, let's say, around the glutes, or you could place them
Okay.
around the cranium, so on
Okay.
the outside. And as they push, they're gonna see that they're pushing, and as
Okay.
they contract, they're gonna see that, oh, now you're contracting your muscle. So it's
I
giving
see.
them feedback, and they're
Right.
able to really make the connection with their brain muscles. So
Okay.
yeah.
I'm so happy that you brought that up because that's such a great resource, and now I'm gonna have to send you guys more people.
But it's actually also good to know that you're treating, because I knew you were treating moms. From
Hmm.
all the patients that I see, they're all saying, "Oh, Riley's great, Riley's great." But I didn't know, and I knew you were treating like newborns, but I didn't know
Yeah.
you were treating like kids also.
Yeah, yeah, I treat
Yeah.
kids too. A little bit less than, let's say, babies, but and it's interesting that we're having this conversation now because in the last little bit I've been seeing a lot of constipation cases. And anyways, I think everything, I just feel like I learned something. So thanks for that.
For sure, for sure. And maybe if I can add one last thing is that we try in physio, we try not to see them before, let's say, maybe like 4 or 5 first,
Okay.
just so that they can understand, but also just to give them the time to develop their full continence, like their full, like
Hmm.
rectal continence, let's say.
That makes sense.
Mhm.
So, for any issues, anorectal issues, is it always a pelvic floor issue? As a manual therapist, is there anything else that you guys might look at for anyone dealing with any sort of digestive difficulties or dysfunction?
Yes. So definitely we're going to take a look at the tension in the abdomen, let's say the breathing pattern. We're going to try to make a really like a holistic assessment. But that being said, same thing as I was telling you earlier, sometimes it's really not a pelvic floor issue. And although we can still help, it's going to be like an underlying condition, for
Okay.
example, endometriosis. And I feel like it's really interesting
Hmm.
now that I know that you made a study on endometriosis. But so we can send them, we can actually work with osteos to help a little bit more. It could be IBS, but also like problematics more related to the hormones, for example, hypothyroid.
Hmm.
So and that's the case, then we're definitely gonna try to seek the help of a like their healthcare, like
Of
their
course.
GP or a nurse practitioner.
Yeah.
Um, yes, but we can still try to help through the habits. And if let's say it's a lack of sensitivity from the rectum, so
Hmm.
that's not really the pelvic floor, but as I was telling you earlier, sometimes it's the rectum that because for example, if you place something in the rectum and you let it there, eventually the rectum is not gonna, it's going to ignore that, right? So I'm
Right.
pretty sure we all had a point in our life where, oh, we needed to go to the toilet to with our stools, and then
Yeah.
we can't, so we're holding ourselves, and eventually it just goes away, right? But if we do that all the time,
Repetitively.
exactly, then the rectum will lose kind of its sensitivity, or the
Hmm.
threshold is going to be higher. So
Hmm.
in that case, we can actually try and teach the person how to feel that that threshold a little lower again, so that
Makes
they're
sense.
not as constipated.
Yeah. It's the same with the bladder, right? If you're constantly voiding or going just in case, you're I don't want to say tricking your brain, but you have an effect on your nervous system and that feedback to when, it's time.
Yes, exactly. You're right. You're right. And I had this conversation actually today with Marie-José, the owner of
Okay.
the clinic. And that's what we were saying, how it's important to also listen to that part of your system, your nervous system, that is telling you to go and avoid your stools, or else you're
Hmm.
going to increase the other part of your system.
Right.
Um, and that's going to kind of almost prevent you from going.
Right.
So. Mhm.
Makes so much sense. Do you guys work on the nervous system? Is there a physio approach where you try to work on the balance between parasympathetic and sympathetic?
Mm. That's very interesting because I'm trying to find some studies right now of work that we could do in physio to help with the nervous system.
Yeah.
Right now, the approach that I use is really just trying to calm down the nervous system through breathing, a lot of breath
Nice.
work to kind of increase the vagal nerve tone, which is related to your parasympathetic system, which is the
Hmm.
rest and digest for people who don't know what it is about.
Mm-hmm.
Whereas the opposite, the sympathetic system, is really the like what we call the flight, fight, or freeze, right?
Yeah.
So if that system is a little bit more, let's say, higher up,
Mm-hmm.
well, of course, you are not going to feel like you need to go and void your stools. And
Mm-hmm.
on the long run, it can create a lot of different problematics. But I'm sure you have some techniques in osteo to work on
Yeah,
that.
definitely. But I was just curious what the physio approach is, and I just think it's great that it's being mentioned in multiple domains now, and because
Mm-hmm.
we focus a lot on like the vagus nerve and balancing and our approach, and I definitely think I could find some research that could be interesting. A lot of it is theoretical.
Mm-hmm.
I'm sure you found
Mm-hmm.
that,
Yes.
but you know, just getting the lumbar spine moving or simulating the sacrum, like because that those
Mm-hmm.
are the nerves that go to the digestive tract, as you know. Um,
Yes.
yeah, but
Yes.
I couldn't agree more with what you were saying, and I tell that especially to my moms who are so busy. I'm like, you need to find a time where, like, it sounds like it sounds ridiculous when you say it, like to poop, you need to take time. Like for a lot of people, it works in the morning, like getting up. I know it sucks, you're tired, but giving yourself that like 15 minutes where you can just like sit and
Mm-hmm.
focus on the elimination process a little bit, allowing yourself to tap into your parasympathetic nervous system, getting things moving, have your cup of tea or coffee, whatever it is you'd like to have in your morning, and just having that little period of time so that you can go. That's going to prevent bloating. It's going to have a great effect on your pressure system and just prevent, like we've been talking about, creating any sort of problems with the pelvic floor.
Exactly. And we know the pelvic floor is related. There's so many fibers in the pelvic floor that are innervated by the autonomous nervous system, so the sympathetic and the
Mm,
parasympathetic. So of course, it just makes a lot of sense that if you're trying to get your time, if you're trying to stimulate your parasympathetic nervous system, everything in your pelvic floor is going to go a lot better. So
that's
talking about
great.
the stools too.
Yeah,
Yeah.
awesome. So do you have any tips for constipation or overall digestive health? So any dietary tricks, self-massage, time, or stress management?
Well, it goes well with what we were talking about. So definitely the stress management, but also just taking the time in the morning, create a habit of going every day, let's say, or every time you're going at the same time. That's gonna help a lot
Hmm.
to prevent yourself from getting constipated. Also, just increase the intake of water. Sometimes people are coming in, they're constipated. They also have a huge increase in their urinary frequency, but then you ask them, okay, how often or how many glasses of water do you drink? And they tell you, or I drink 2 glasses of water a day. So
Hmm.
that's going to play a major role too,
Yep.
to bring some water into the stools, to make it also easier to pass them. Um, Definitely to eat more fibers. I think we hear that often now. You know, your
Yep.
all brands, but in any type of food that you could get them, try to get your fibers. Sleep is also very important
Hmm.
in the transit in general, because as you sleep, well, it's going to give time to your bowels to actually work a little bit more.
Hmm.
And on top of that, we know you don't have your sympathetic nervous system also high up.
Yeah,
So those would be just overall digestive health and constipation tips.
those are
Yeah,
great. And I
there's
know, well, I think maybe you posted on your Instagram, or you had taught one of our mutual clients about the I love you massage too.
yes, it's
Yeah.
true. It's true. So that's also a good technique if people are feeling bloated, or they feel like they are not able to get their um, let's say their bowels to work, and to
Yeah.
feel feeling that, oh, I need to go have my poop.
Yeah.
So yes, the I love you massage works really well, and I feel
Hmm.
like it's easy because it's something that the patient can do, and they feel like, oh,
Yeah.
I'm empowered actually.
Yes.
I don't know if you wanted me to describe it, but I just don't know how people are gonna see
Oh
that.
yeah. I can link it to the episode. I'll post it with our episode. I think I've posted a video about the I Love You massage too. So
Oh,
if
good.
you've made one, I'll post yours or mine just so people can
No,
get a nice visual. I also like
yes,
it because kids really like it, you know? It's the I
yes.
Love You massage, so they're more inclined to do it from home.
It's true. It's true. And it's very easy once you understand like why it's called I love you, it's really easy
Yeah,
to remember and to
absolutely.
do all the time.
Yeah.
Yeah. Yeah.
So I'm going to switch gears a little bit and talk a little bit about postpartum. So all the moms that I treat are worried about their first poop postpartum. So I was just wondering what your recommendations for postpartum moms with this in mind.
Yes. So usually at the hospital, they're going to give you stool softeners. So
Mhm.
that might help a little bit. But let's say in physio in general, we're not allowed to really give out
Of course.
recommendation. But if it was to one of my really good friends, let's say, um, I would tell them to maybe try to use Laxaday or Metamucil, which are not really the same as laxative stimulant.
Hmm.
Um, so they work more into bringing the water into the stools and
Okay.
to helping to soften them.
Yeah.
Um, Definitely all the tricks that we spoke about just right now with like the sleep, eating fibers, drinking water. But
Hmm.
there are a few things I would focus more on with new moms. For example, I feel like when you're stressed, you have your newborn, you might not take the time to just go and sit on the toilet, but that time is very important, as we said, to create the time and not to postpone the urge. That's
Hmm.
going to be very helpful because when you feel like you need to go, it's as if it's going to happen naturally.
Hmm.
And more specifically, if there was a tear, let's say with a vaginal delivery, I would ask them to do some splinting. So I don't know if you're familiar with the splinting.
No.
It's something very special, but it works well and it reduces the pain if there's tears. Even people with prolapse could use that.
Okay.
But you basically take a piece of toilet paper in one of your hand and you're gonna place it on your perineum
Okay.
where there was the tear and you
Yeah.
apply a pressure. So then when you void your stools, the part where you have your pressure is not going to be
Mm,
stretched out, and that
I
helps a lot
see.
to reduce the pain around the tear.
Okay.
And for C-section postpartum, I would tell them to try and create kind of a bind around their abdomen. I had one of the teacher, she was telling us that, oh, when I delivered, I had a C-section and I had to cough and I couldn't cough because my abdomen was not strong enough. Well, it's
Hmm.
the same thing when you go and void your stools. If your abdomen is not strong enough, it's going to be uncomfortable. It
I
might be
see.
painful. So you can wrap yourself around with anything that you can find, or you
Okay.
can even put a pillow, but sometimes it's not hard enough.
Yeah.
And then you create a pressure by pressing
Ah,
on your abdomen. So
makes
that's
so
gonna,
much sense.
yes, and it directs the pressure downwards and it facilitates the stools to come out.
Okay.
And the last thing that I would maybe ask a new mom to do, but that I think I would tell anyone who's constipated,
Okay.
um, I feel like this trick is magical, and ever since I learned it, I'm just using that, and I feel the stool, the bowel movement has been amazing.
Yeah.
So it's the famous step stool that you would put under the squatty potty that you would put under your feet,
Yeah.
um, as that's going to open up a little bit more the angle between the rectum and the anal canal.
Hmm.
And then the magic part is really when you just do a fist with your hand and you're going to blow into your fist.
Okay.
Um, and the pressure that it does, you don't have to strain at all, but the pressure is even more than if you would be straining or if you would
Hmm.
be like inhaling, exhaling to void your stool. So I
Okay.
feel like with that, new moms should be they
Well,
should be in
well
better.
prepared.
Yes, exactly.
Oh, that's really
Exactly.
awesome. Those are some tricks that I hadn't heard of. So thank you for that.
Of course, you can try them and let me know
Yeah.
how it goes.
Okay. Okay, so we're wrapping things up. A new question that I like to ask is based on whatever field the interviewee, yeah, that's you, is from. I like to ask, so what are three things you wish for pelvic floor therapy as a service, like for their future?
The first thing I really wish, and it's not necessarily for the service of physiotherapy, but I really wish we would teach some of the basics at school, because I've had so many patients that were shook because they didn't learn that at school, and I think that it would prevent so many issues that we see, not even related to constipation, but constipation also included. So that's really the first thing that I really wish would change.
It's funny that
Now,
you mentioned that, because I've had this conversation a few times. I don't understand why biology is not a mandatory class in high school. Like,
yes.
people should need to know where like just knowing like your anatomy in a basic
Yeah.
way, I think is
Yeah.
so important, because like it can be dangerous not to know that. And then,
Yeah.
how can you be empowered, when something comes up, when you don't have the basic tools to communicate what you're feeling or which part or healthcare? I don't know. It's just, anyways, I could not agree more with that. I think there should be very specific women's health things that are addressed because of like our ability to birth children, and just the effect that can have on our overall health, and what resources exist, like that should be included in a mandatory biology class. Anyway,
Definitely.
I
Definitely.
totally agree.
Yeah. Yeah. And I feel like as women, we can even understand that more. There's so many
Absolutely.
things I've learned through my studies, and I'm telling myself, wow, imagine like not knowing this and then going through something you don't even
Yeah,
know what's the issue. It's yeah. So
absolutely.
mm, yeah.
Great
And
point.
then I hope eventually pelvic health in all of its forms, so pelvic health physio, pelvic health osteo, anything pelvic health related, I really hope eventually it's going to be something offered or even required automatically after birth, or even any type of surgery. And for example, after C-section, which is actually the main surgery or procedure done at the hospital, um, women are not even talked into doing anything for their pelvic health. And same for vaginal delivery. People are not told to go and get an assessment for their pelvic floor.
No, they're
And
told
it's,
feed your baby. If you don't feed your
yes,
baby properly, you're not leaving here.
yes,
You're not important anymore.
it's only, and I mean, it's important the baby, but you're right. It's as if we tell the mom, okay, now
You don't
you're
matter.
not exactly. And it's so special to me when you tell someone who has a hip surgery to go straight into physio, for example. But when it's related to the pelvic health to the new mom, it's just like, okay,
Yeah.
just get it going with your baby. It's
hmm
so that's something that even upsets me.
I think
But
I've said this once on the podcast before. My boyfriend is an orthopedic surgeon, and
mm,
it's like he does laparoscopic surgery. He's so good at doing ACL surgeries.
mhm.
It doesn't take, okay, it's a very, very good skill. I'm not trying to minimize it, but it's a less
Yeah.
intense surgery than a
Mhm.
C-section. And maybe someone would
Mhm.
disagree with me on that, but, and he like gives his patient a list on like weekly, like what the milestones are that should
Yes.
be reached. And there's so many studies that are
Mhm.
published, and they know exactly what to do after that. Whereas
Mhm.
women leave the hospital, like we said, where they cut through major layers and organs,
Yeah.
and zero information. Not
Mhm.
even like it just it should be at least, even if we don't get to the point where it's included in the hospital system, which like I really hope that that's what it comes to one day. Like
Mhm.
it should be mentioned when you leave the hospital.
Definitely. And that's very interesting, the comparison that you made, because it's true. I feel like some people, for example, an ACL surgery, they're going to know exactly what they should
Hmm.
feel and when they should
Yeah.
be at this step. So yeah, very good point. Yeah.
Yeah.
And the last thing I would like for pelvic floor therapy is for people to understand that we treat a lot more than just incontinence and or
Mhm.
even mom postpartum, and that it is not because you don't have any symptoms that there's nothing. In my opinion, we should just all go for a checkup, and then if there's really
I
nothing,
agree.
yes, yes.
Because like we've
So.
said, it's these subjects are taboo and people don't talk about them, and you just start telling yourself that you're normal until you
Mhm.
sit down with someone who's like, no, no, like this pain that you've had or X, Y, and Z is not the norm. You should not be suffering with this. We can make this
Mhm.
better. There are resources. People don't even know.
Yeah, exactly, exactly. And I'm pretty sure you probably have had that a lot of times too, but sometimes people are coming in and they ask, how come I never knew this existed? Or it's actually my first time hearing about pelvic health. So
Yeah,
yeah, very true. Mm.
that's great. Well, is there anything else that you wanted to say before we part?
Oh, actually, I think that sums it up. It's very interesting, and maybe just don't take the constipation for something that is not important. It is
Yep,
actually very important. Yeah,
absolutely.
yeah.
Well, thank you so much, Aisha, for coming on the podcast. And I'm so happy that I got to meet you and I learned so much today. So I'm really grateful.
Well, thank you. Thanks to you, actually. Thanks for inviting me. It's such a pleasure to do my first podcast ever. So yeah,
Well,
I'm
I look
really
forward
really
to
thrilled.
having you back on one day.
Definitely,
Okay, well,
definitely.
have a great rest of your night.
Thanks. You
Okay,
too.
bye.
Bye.